Hello, everybody. Thanks for joining us today. I am Kathie J, and guess who I have? Dr. Aaron Kovaleski from Ecco Medical is our guest today. Yay!
How we doing, everyone? How we doing, Kathie?
I am so happy that you're here. I love you, first of all. You are such a good person.
I love you too. Thanks for having me. It feels great to be here.
Yes. I tricked you into saying it. I'm kidding. But I love you because of what you do to help women in our community. And it's amazing. So ladies, so you do a lot because you are an endovascular specialist.
Correct.
So that means if it's dealing with our veins,
arteries. So essentially what it is, it's doing minimally invasive procedures using image guidance. So we can treat a variety of conditions without having to do any kind of surgery, no incisions. So we can do a needle stick into an artery, a vein, thread a little tiny wire through that needle into whatever it is. And, it's like I say, if you stick the toe, you can get to the brain. So I can get to anywhere in the body once I'm in a blood vessel. So I can treat anything anywhere.
Okay, so that's terrifying.
It is terrifying.
And fascinating.
Yeah, sure. Yeah. But people are sedated for it.
Okay.
So, that helps.
Are we sedated?
You're sedated for the procedure, so you don't remember anything. And like I said, it's only a needle stick, so there's no incision. So while needle sticks aren't fun, we at least numb up the skin so that you don't feel anything when it happens.
Okay, so this is what I love. This is one of the things I love about you, Dr. Kovaleski, is what you said is it's minimally invasive, blah, 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 blah. But on this side of the other alternative that you are helping people with their minimally invasive, the other side is hysterectomies. Horrible surgeries or numbness that can lead to heart attacks. There's a whole other world of medicine, of a message, I think, that's being sent out there. When you're over here saying, I can do it so much easier for so much less. Please talk to me about that.
Sure. So whenever we talk about minimally invasive image-guided procedures and things like that, it's a lot of words. Essentially what these are alternatives to major surgeries.
Yeah.
So if I go up and open up blood vessels in the legs to prevent limb amputation, your alternative is limb amputation. So if I can open up the blood vessels, restore blood flow in your legs, then it's a needle stick procedure that saves your leg and keeps you walking. If it's uterine fibroids or benign tumors in the uterus that's causing you heavy bleeding or even infertility, the other option is hysterectomy, and I can prevent having to have that major surgery because that's a long recovery. It's in the hospital. You're getting general anesthesia. We can avoid all the complications of surgeries by just, like I said, doing a single needle stick, and the recovery is minimal. They're outpatient. You walk in, you walk out. Minimal recovery.
No, it's amazing. I'm sure people right now, their jaws are dropping. I don't think this message is out there enough. Is it because it's not covered by insurance?
No, it is covered by all insurance plans.
I don't get this. I don't get this.
Including Medicare and Medicaid. I think, there's competition, right? Medicine is a capitalist thing. So we get paid to work.
Yeah.
And we don't get paid to not work. So if you're a surgeon and you do something, you're not going to want to send patients to me, even though I offer a safer alternative.
Gotcha.
Because you're not going to get paid to do that. So when we send referrals, we don't get paid to do that. Now, obviously, everyone's supposed to be altruistic, do the right thing for the patients, and the vast majority of people do.
Right.
However, there are some private practice docs that are going to be a little bit more on the competitive side and on the business side.
Yeah, unfortunately with everything we have to be aware. That's why you always need a second opinion. And I appreciate your honesty for that.
For sure.
Thank you.
Well, as time goes on, I think one of the things that I'll always promote is patients do have to be their own advocate. I mean, times have changed. It used to be with the older generation, they would just say, I'm going to do whatever the doctor tells me. But now with Google and WebMD and all these other things, patients are becoming more and more knowledgeable, and it's important that patients educate themselves or find a doctor that promotes them being educated on the options that are out there.
Yes, so let's go into the two main things that you really help with people. So arteries, so we've now established that he exists, and it's a simple needle stick that can go.
I exist. I'm here. Yeah, right here, actually.
He'll be here for at least another 20 minutes.
Yep.
And you can literally, let's talk about numbness in the legs and stuff, because that's guys and girls.
Yeah.
So I know, I just thought it was, as you get old, you're probably going to need a cane because it's going to get harder to walk, and you're going to get
a cane. I can't say that you're not, but no, I mean, we all get symptoms as we get older, and a lot of us just say, I'm getting old.
Yeah, I just don't feel it like I used to.
Kickstart it, right? Like 1 foot in the grave,
Yes.
So, No, with plaque buildup in the legs, it happens at about 20% of people above the age of 60, and that percentage increased with each decade of age. So 70, 80-year-olds, they're even more likely to have it. So it's a process that occurs that people are very familiar with it. They're familiar with plaque buildup in the heart.
Yeah, I was going to say,
that
it's like
causes
that in
heart
the heart.
attacks.
Yeah.
So it's the exact same disease state. It's just plaque buildup in the legs. So instead of, I tell patients when they're in my clinic, it's like a heart attack in your legs, right?
Yeah.
You're losing the blood supply to your legs, and so you're going to get numbness, tingling, pain while you're walking, and that's because the muscles aren't getting oxygen when you're using those muscles, and so they start cramping, just like you would cramp on a hot day, right? But it's the same exact concept. You're just not getting the oxygen to those muscles. You can also get tissue loss or wounds that won't heal because they're not getting oxygen to heal. Lose toenails, have black toes, lose leg hair because they're not getting oxygen either. So all of those things are signs of peripheral artery disease or PAD. And the treatment is doing one of these minimally invasive things called an arteriogram, where you go in, you balloon this stuff open. You do the exact same stuff that you do in the heart. You just do it in the legs instead.
You just unclog the arteries.
Take a left. Take a left at the aorta and just go down to the legs instead of the heart.
There are a lot of arteries in us. How do you know where to go? I mean, that is a traffic jam.
So we do a lot of non-invasive assessment before we do these procedures. So we're not going in blind. So we're using ultrasound, maybe even a CAT scan, and some other studies that we do all at the office. So everything's done in the same place. It's all diagnosis, clinic visit, treatment, all done in the same office. So we know what we're doing beforehand without doing an invasive study. So we can just do ultrasound. It's called a Doppler. Take a look at the arteries. Take a look at the veins. We know exactly where the issue is. We know exactly what we're treating. So we're not going in blind. And then when we're there, we have some technology that's super cool. It's the thing that I love it. It's called an intravascular ultrasound. So, or IVUS or IVUS.
Is that what the colored
it's yes.
The ink?
That's the thing. No. That's the other thing. That's the arteriogram.
What is it?
Contrast. No, IVUS is an actual little tiny ultrasound wire that you put inside the blood vessel. So you're actually doing ultrasound of the blood vessel from the inside out. So you're getting accurate measurements, you're doing functional tests and everything in the procedure. So that way you're measuring balloons, stents, and everything else appropriately. So there's no guesswork. You're actually, you know exactly what you're doing.
Wow. So a visit to you actually helps us really know what's going on inside our bodies.
100%.
Wow.
Yeah.
All right. So can you blow out arms too?
Do whatever you want. Bring it on.
So I was asking Dr. Kovaleski before we started the video. I broke my leg 2 years ago, and so sometimes like my toe will go numb or something, and I just think it's from whatever with the recovery of the surgery or whatever. And you're saying, maybe I need to go see you.
You could be vein disease. So anytime you have an orthopedic injury.
Sounds very sexy.
Very. Ladies, you have vein disease.
Yeah, vein disease. Good for you.
Yeah. So anytime you have any kind of orthopedic trauma, like I broke my leg a few years ago and have a bunch of hardware in there and stuff as well. But you need more blood flow to the legs to provide healing. And that can actually cause some of the superficial veins that are just underneath the skin to become non-functional and no longer be able to push blood back to your heart. And so then that actually causes pain, swelling, tingling, numbness, and all that stuff. So you go and you have your superficial veins treated just to reroute blood flow to healthy veins, and then swelling, numbness, tingling goes away.
You say it like it's just not a big deal. All in a day's work.
Just bring it in.
I'm glad it's you doing it.
20-minute procedure. Yeah, it's quick. It's easy. It's again a single needle stick. Yeah.
That is amazing. Okay, and you have people coming in. Do you have people from out of state coming for that procedure too, for the peripheral?
We get people from all over. So I think on average we probably treat patients from maybe 20 plus states a year. And that's for, a variety of conditions. So uterine fibroids, certainly patients traveling from all over. PAD, peripheral artery disease, people coming from all over, and then we offer a prostate treatment as well that people are flying in from. I'm amazed.
I'm sorry, I've never heard that one, and I want to say, do you blow those out too?
Just you gotta get in there. Just like that. No, again,
that was me being inappropriate, nobody else.
Yeah.
But that's because that's also, it's all about circulation.
Yeah, it's just blood supply. So, everything in your body has a blood supply. And so what we're doing, the general job is opening up or shutting down blood vessels depending on the condition we're treating. So if it's a uterine fibroid, that's got too much blood supply and we need to starve it. So we go in and we cut off the blood supply to the uterine fibroid to shrink it down so that way the symptoms that the fibroid itself is causing improve or go away altogether. But if you don't have oxygen supply to your legs, then we want to restore that blood flow. So we're opening up the blood vessels instead.
Yeah, no. So the alternative to not coming to see you and opening up your blood vessels
Sure.
of peripheral artery disease, the alternative, it could lead to stroke, heart attack, everything that happens when your arteries are clogged.
Absolutely.
Like you said, amputations, all that stuff. So to me, you're definitely a worthwhile second opinion.
I would think so. I would hope so, right? I mean,
okay.
even if you don't come to me, I mean, please go see an endovascular specialist for pretty much anything, even if you're not going to go that route. Get educated on the condition that you have and the treatment options. Doctors are human, okay? We're not perfect. We don't know everything in the world. We definitely know what we know, but there's going to be things that doctors don't know. So make certain you educate yourself after any doctor's visit and make certain that you're aware of all the treatment options and not just what that physician spoke with you about.
Exactly, because Dr. Kovaleski has lasers that are really...
lasers all over the place, yep.
So now let's get into the uterine fibroid embolization.
Sure.
So this is where women come from out of state for your procedure.
Absolutely.
I have a girlfriend, I have a girlfriend, and when we were 34, she lost her uterus because she got the uterine fibroids.
Yep.
And I just remember how sad it was, one, that we were so young, two, her recovery was there on the maternity ward of the hospital with all the other women celebrating having babies. There she was having that removed. Then it was, 5 weeks of she couldn't go to work. I mean, I just remember it being horrible and the pain she was in prior to her having it removed. So she thought, well, obviously this is the end and how it is for me. And there's so many other women out there like that until they hear of you. Tell them how you can help them have kids still.
Yeah, so uterine fibroids affect 55% of all women.
That's a huge number.
It's huge.
That's huge.
Literally more than half, and that's math.
Yes. Wow, he's the doctor.
So more than half of women, all women, get uterine fibroids, and then there's an association with skin color. So the more melanin you have, so the darker the skin you have, the more likely you are to have it. So 70% of African American women have fibroids. So uterine fibroids cause horrible cramping that go with your cycle, heavy bleeding, some women requiring transfusions every 1 to 2 months because they're bleeding so much just from
I have had girlfriends like that, yes.
And then also it can cause infertility because the fibroids themselves will deform the uterus enough to where eggs cannot implant in the normal endometrium. And so patients that are going to fertility clinics, they've been trying for years, they can't get pregnant because they have a physical obstruction from being able to conceive. So what uterine fibroid embolization is that I actually go through the wrist for this. It's an outpatient procedure. It takes about 45 minutes to an hour. You're in the office for maybe 3 hours and you go home afterwards. So I do a needle stick in the wrist because, one, it's easier to recover from. It's just underneath the skin. There are no major structures close by. So ultrasound guidance to get the needle into this artery. I thread a wire through that needle, come up here to the aorta, or really the subclavian artery, turn down the aorta and go into the pelvis. And then using real-time software and X-ray and ultrasound guidance, we create a vascular map, a 3D vascular map of the blood vessels in the pelvis. So that way we can guide our equipment, which is a wire that is very tiny, about the size of a human hair, and a little tube. We call it a catheter. A flexible tube is a catheter. A lot of people think urinary catheter, but this is just about a 2 millimeter or 1.5 millimeter tube that we then guide that wire tube system into the arteries feeding the fibroids. We inject these little tiny beads that you can barely see with the naked eye into the capillary beds feeding the fibroid. That blocks off the oxygen exchange to the tumor, therefore starving the tumor so it shrinks or goes away altogether. So if you've got cramping and this thing is causing your cramping, it goes away. If it's causing your bleeding, it's stopping your bleeding. And if it's causing a physical deformity to your uterus so you can't conceive, it helps alleviate that.
Dang.
That was a lot of information.
That was
Thank
a lot,
you.
but you covered so I know.
Yeah.
Yay, he did it.
I did it, yeah.
He knows what he works at.
Yeah.
As you're talking, in my head as a woman, I'm hearing so many females in my life having all these issues, not knowing that you existed. So I'm really grateful that you are here and your staff is amazing, and thank you.
They're awesome.
Yeah, they really are.
I'll say maybe the most satisfying thing, or at least from my end, when I see these patients, they show up in the office and they've been to 4 OBs and every single one says get a hysterectomy, and then they show up and you tell them that there is this alternative. And then you tell them, by the way, all of evidence-based medicine shows that it's equally effective to hysterectomy at symptomatic relief. It's satisfying, maybe a little sad at the same time, but their jaws hit the floor, and they all say the same thing. I can't believe no one told me about this.
Exactly.
And it's covered by insurance.
I'm sure they just got to be crying.
It's been around for decades. It's not like
What?
it's new. It's been around
What?
since the
Here, I
70s.
thought it was something that you just created. I was like,
yeah,
you got
made it last week.
I know.
Yeah, no, it's been around for decades, and it's just one
This
of those
really
things
makes me mad.
Yeah, I mean that's another soapbox.
Yeah, right. No, that is another soapbox.
Yeah.
I mean, and you're saying also black women definitely, if you have a black woman in your life, make sure she's getting checked.
Absolutely.
And that she knows about this alternative. Yeah, that's awesome. Okay, thank you, Dr. Kovaleski.
Yeah.
Is there anything else that you'd like to share with everybody before I let you go today?
I love Kathie J.
And I love you.
It's so
too.
great to be here next to her. But no, really, it's been great to work with Cozy and just be back on the radio with a good friend. And
you know what? You're a great dude, and I love you, and I love your son, and I'm proud of everything that you do, and I know how hard you've been working you're finally a doctor. No, that didn't come out right. I run into people all the time that have just known you through residencies and everything throughout your career coming up, and just always have said how much you love people and you just really want to help them. And obviously, this is one of those things.
It's the best way to do it.
Yeah, it's awesome.
Yeah.
So thank you. But I am coming in to get completely blown out.
Yeah, let's do it. We'll check it all out. We'll fix everything.
Everything feels numb. Like my toe feels numb right now.
We'll fix
everything.
everything.
All right, everybody. So this has been Hanging Out with Kathie J. Thank you so much. Take care, everybody. Remember, you can go to Ecco Medical, ECCOmedical.com, and you have quizzes. You have a quiz right there.
Quizzes for fibroids, quizzes for PAD to see if you have the symptoms consistent with it. So.
Yeah, and do that. So or you can give them a call, 303-529-8076. Bye, everybody. I remembered it.
Yeah.
Kathie J.